everyone, and thank you for joining me for this podcast. My name is Louise. I live in Israel and work at the Innovation Center of Denmark in Tel Aviv. And I specialize in health, life science, innovation. On my podcast, Healthy Innovation, I explore new, hot, interesting, inspiring, and relevant topics within these fields. And today I want to talk about mental health. So there's a lot to say about mental health. It is a topic that I would say finally is being discussed more and gaining more attention also on a political level. Mental health is no doubt one of the burning platforms in our healthcare systems. And it's an enormous challenge for a lot of countries, and it affects so many parts of our society. In recent years, not least during COVID and following COVID, we've seen a surge in the number of people suffering from mental health disorders. I was really shocked actually to learn that in Denmark, for example, 1 in every 4 young women is considered to be in poor mental health, which to me is a staggering number, considering that Denmark is a small country of high socioeconomic status with a well-developed healthcare system and healthcare services of high quality. But I understand also that on a global scale, mental health is the 4th most common cause of death. And it's expected that approximately 50% of us, that is every second person, will sometime during our lifetime suffer from some kind of mental health disorders. And I think these numbers are just extremely high. There's no doubt that mental health has been neglected and underfunded for many years. And we're now starting to realize that urgent action is needed, new solutions are required, and that's also where innovation now comes in also as an important tool. Israel is one of the countries that's starting to look more intensely at mental health. We're also now currently in the middle of a horrible war and security situation in the region that will have an enormous mental impact on the population here. So today I want to have a conversation with the director of Enosh. Enosh is the Mental Health Association in Israel, Dr. Hilla Hadas. Thank you so much for joining me today. I'm really excited to have a conversation with you, as you are also trying to bring more attention to the area and more solutions to a topic that really affects our society. And I think it's crucial that we shed a brighter light on this topic. So thank you for coming.
Thank you for this opportunity to talk about an extremely important arena.
Yeah. So, but before we dig into that, maybe you could just say a few words about yourself and about Enosh.
So again, thank you for the opportunity. About myself, I'm PhD in biology, in life sciences. People think that I'm a psychologist or a psychiatrist, so no, I am not a mental health expert by profession. I am a mental health expert in my daily work for 17 years. Before then, I've been in the academic arena. I've been lecturing, researching. So my life been in the academia until I moved to Enosh. And Enosh is an organization that was founded by mothers 45 years ago. In 1978, when they just started, the situation in Israel was that mental health was a situation that nobody wanted to talk about, nobody wanted to listen to, and those mothers that experienced at home situation with their loved ones, they understood that they need to change the arena.
Right.
And they came together, and it's really amazing to understand that the way they worked they were walking in the streets and looking for people that looked like they're
struggling with mental health issues. Wow.
Because at that time in '78 there were external signs for the out of the medication.
Right.
And they put together 3 goals. One of them is reducing stigma, or reducing the shame barrier,
topic,
and it's a challenge that we still need to work on. The second one, lobbying, trying to change the way the policy in Israel is looking on the situation, and they advocated for better rights for people who are suffering from those situations.
Yeah.
And eventually in 2000, Israel legislated a very comprehensive law that says that the government is responsible to provide mental health, community-based mental health services. And the third one, because they understood that talking about stigma and legislation is talk, is words that you, and if this, and as long as this field is so neglected, talking won't make any difference. So they started to develop services. So since 1980, Enosh is an organization that, in a very innovative way, put on the table new services, or on the, in the field, new services that will help people to cope with the situation. Everything is community-based, and since then we, this engine is goes on, and we develop new services to the arena and to the people who are in need.
And then do you collaborate with the healthcare professionals in that, or are you running kind of in addition to preventive measures and treatments through the healthcare system?
Actually, Enosh is now considered to be the most impactful, and at the same time the largest provider of community-based services in mental health in Israel. We provide services to the people who are in need, and most of what we do is now paid by the government as a consequence of the lobby that we've done along the years. So we are a provider, and at the same time we work on reducing stigma and new legislation processes that needs to be done.
Wow, yeah, very impressive. So first of all, how would you define mental health?
I think that this question is a philosophic one, and can open up a very deep discussion. When we in Enosh talk about mental health, we are including from well-being to a situation of diagnosis that was done by a psychiatrist, but the whole continuum from well-being to being sick is very wide. So from our point of view and from my point of view, mental health is a situation where a person can live full and meaningful life in the community, regardless the distress or the situations, life situations that he experienced, and the fact that you can live meaningful and full life is a consequence of resilience, of getting the right help if there is a need. So this is about in a short way to explain what is mental health for us.
Yeah, and so how would you describe the mental health crisis that we are facing in many countries at the moment?
You mentioned before the COVID, and I think that the COVID was the first global situation that affected everybody.
Yeah.
And when we look at about this, situation of the pandemic, for me it was an unveiling of its situation that was there, but nobody really want to admit.
And why didn't we want to admit that?
It's very deep.
Yeah.
Because when people are in a severe distress, they might behave in a weird way. They might need attention.
Mm-hmm.
They might be strange in so many ways. And in this new world, we don't really want to listen.
Yeah.
We don't really pay attention in a way that will allow deep understanding of situations.
Mm-hmm.
So we like to move on, to be fast, to ask how are you and go on, not
Mm-hmm.
really
No.
be in a mood to listen.
Yeah.
And that's one issue. Another issue is how we've been, educated. When you go to the films that were done, that were filmed, in the 90s, so the Cuckoo's Nest.
Yeah.
So what is when you close your eyes and you think about somebody who is in mental health crisis, what do you see? You see something that you don't want to belong to.
Yeah.
So even if you feel that something goes wrong, or your family members see that something goes wrong, they will wait and do everything to cover, to try and solve, which is good.
Yeah.
But if you try to solve without any help, without consulting anyone, so the situation will become worse and worse.
Yeah.
And then, so it's part of it is huge fear.
Mm-hmm.
What is to be in a situation like this, and what does it say about me?
Yeah.
Who am I?
Mm-hmm.
Can I be a meaningful person if I suffer from mental distress or mental disorder?
Mm-hmm.
And nobody talks about Churchill or Catherine Zeta-Jones,
Yeah. Right.
who've been diagnosed and been very meaningful people in the world.
Yeah. Yeah, and I think it is a lot of the stigma due to lack of education around what is mental health disorders and how are they best treated and how do they limit people. And I think there's been a fear of people admitting that they have disorders in fear of reaction, especially from the workplaces.
Mm-hmm.
And do the workplaces think that you can actually function in your function if you say you have a mental disorder? Which you can if you get
Mm-hmm.
the treatment that you need. Yeah. Okay, so what did COVID kind of reveal to us then about what are we facing and what do we need to do?
So COVID was the first, I would say, a world situation that exposed how many people are isolated, or what is the effect of being isolated and how it can affect your mental status. And now in Israel, we have this horrible situation of war that nobody really knows when it will be ended. And the situations are, and what you hear about the experience that people been through is it's so hard to internalize or to accept or to understand. And so we are now, people describe the situation as a national trauma.
Yeah.
And we are
Right.
a nation in trauma,
Right.
and there is a national trauma. And luckily, most of us will cope
Right.
and will go back to pretty much normal life.
Mhm.
But we will have many that will suffer from the post-trauma effect, and even will be diagnosed with severe mental health situation, because
Right.
this time is causing a lot of triggers to show up. And
Yeah. So, what do you think are kind of the challenges or the barriers that we need to deal with in order to improve the situation of how mental health is dealt with in our healthcare systems? That could be policy, workforce, education, technologies. What do we need to do to improve the situation of providing better mental health care as well?
we need, first of all, to be cautious with the situation, to understand that it's big and that we need to use many tools.
Mm-hmm.
The first tool is resources. Without extra funds to the health care and to mental health care, especially, we can't solve the problem. Yeah. And the problem of funds in Israel, the mental health system in Israel is funded 50% of the need.
Oh,
so
wow.
the
There's a way
lack
to
in
go.
resources
Yeah.
is, we have half
Yeah.
to what was needed before the war.
Mm.
That's the estimations and a solid estimations.
Yeah.
So, and all over the world, there is a need to put more money, because as much as you add funds to mental health, you gain it back in your GDP, because
Okay.
people will get help early.
Mhm.
Most of the help will be preventive. It would be for less, for shorter times.
Yeah.
The time that you will
That
need to
they're
be
out of the workforce.
out of work,
Yeah.
and to get help.
Mhm.
And then you can go back and live meaningful life
Yeah.
in a community and work and contribute and participate and,
Yeah.
and be fruitful,
Mhm.
and it will reduce the burden on health care and שירותי רווחה
Like social
and
services.
social services.
Exactly.
So funds are needed because there is a need to invest in order to gain. And normally, and at least in Israel, governments, they don't like to invest before they know how much they will earn back.
Yeah.
We need to do a lot to educate the population from very early age, because the fact that kids and the young, adolescents, they don't have the right language. What is,
Right.
a distress? What is an emotional crisis? And when you don't talk about, so you don't share, you don't get, and not everything should be done by professionals.
Right.
Educators, counselors in school, even in youth movements.
Yeah.
They can be helpful. We are now living in the modern world. We kind of break the community life.
Yeah.
Community is the first place where you get support, and many situations can be solved. So education in very early age to them, to the students themselves,
Yeah.
or pupils, depends how you word you use, and to educators.
Right.
Because educators in schools, they the fear of if they will do something or will talk about, and then the situation will worsen, and
Then it will come back to them.
that
Yeah.
they were responsible.
Yeah.
So at one hand, resources, at one hand, education that needs resources and attention.
Right.
And then we need to bring many more professionals in Israel. There is a lack of professionals that work for the public sector.
Yeah.
There are many in the private sector, but much less in the private sector, in the civic sector, and that's why in Israel we have the time it takes you to get help is, you know, you can wait 8 months, a year to get help, and then technology comes in. Technology can be very helpful with self-help.
Okay.
As much as we use technology in order to educate and helping people to do whatever they can do to themselves will be very helpful, and as a tool to support clinical help.
Okay.
So when we will use technology when there are long lines or in between sessions, it will allow to bring some air into this, packed situation.
Right.
No funds, no professionals,
Yeah.
and many people who are in need.
Yeah, if the numbers that we're seeing are good estimates, it's a huge burden. A lot of people are waiting for help.
Yeah, and
basically.
the estimation in Israel is that there will be increase of at least 60,000 people into the long-term services.
Wow. Yeah.
Which is a huge estimated growth.
Yeah. And now also talking about what Israel is facing, which is a special situation in the coming years. Are there any type of solutions that Israel is very much in need of right now that maybe some of the listeners would know of in other places that could assist with helping with this burden here in the region? Because we have a lot of people in the whole region that will be traumatized after this whole war ends.
Israel made the decision after the Second Lebanon War to open resilience centers.
Okay.
There are 6 of them, most of them in the south and one in the north. And a resilience center is a place where, at one hand, there is therapy for people who are coping with trauma situations, and even for when there is the beginning of post-trauma, so you can get help, and it's a professional help that you get in this resilience center. But the name Resilience Center comes out of another mission that those centers carry, and they work to educate the community around and to build the community as a resource for immediate help when there is a massive need. And they have volunteers, and they have groups of people who are on alert when the siren comes on. They would jump immediately to the area, because we understand that as much as you react immediately, you prevent a situation to be worse.
Yeah.
So the understanding that you need to educate and to build a system to cope with uncertainty. because you don't know when a situation will occur.
Yeah.
But the importance is to build community resilience to cope with situations. So this is one, on one hand, knowledge that can be transferred to many other countries.
Yeah.
And we helped, Israel helped the Japanese when they had the situation with the nuclear plant. And even in Ukraine, we send people to educate how to work with those situations.
Yeah.
There are many, I would say, platforms now, digital, to try and cope with the situation. Most of them are, very new.
Yeah.
So
we'll
it's
have to
really
wait and see.
hard to tell.
Yeah.
And at the same time, there is a need, and we do it. To build new services that would be for the public who are in the first distress, again, to eliminate worsening of the situation.
Yeah.
And that's pretty much about it. We can't invent something that is not here.
No.
But at the same time, we need to be. It's kind to open our mind to new solutions that people are offering, and because we might now create the new database solutions.
That's true.
Because in mental health and as a medical arena, most of what you do should be evidence-based.
Right.
But in a situation like this, when we have so many, this is the right time, in a very cautious way, to build a new evidence base.
Yeah, we often see that crisis is often advances innovation much faster than otherwise. And I think maybe the Resilience Center could be a good idea in an adapted format to be something that's used also in just everyday life ways of dealing with mental health. Maybe it is, as you said, moving it closer to the community and building these centers so that we catch people early.
Yeah, President Kennedy said that you should repair the roof when the sun is shining.
Yeah.
But as human beings,
easier said than done.
We don't repair roofs when the sun is shining. And when you talk about roof, it's something that physical, that you can, you can see and you can talk about as evidence. But when you talk about people, you don't. What is to repair the roof when the sun is shining? This is resilience, and this is education, and being open, and talk about emotions, and learn more about how can you help yourself, and how can you reduce depression or distress. And as much as we will, everybody in the world will start early, we will
the better
be,
results we'll have. Yeah. So just one final question. Let's look into the future. And if you're thinking 10, 15 years from now, what do you think, according to what's happening now, will have been the best initiatives that we have put in place to provide people with a better situation for dealing with their mental health?
I think that most of what we will see is better education. The young people from very early age, even in the kindergarten.
Yeah.
They will be more open to share emotions and to know what to do, and even and I think that we would, we now talk about the environmental distress or problem, and those problems will come together. Because the new fear in 10 years will be environmental.
Right.
It would be, I think, the most fear, even more than a fear from war, or because confidence will come if you'll have resources. And
Right.
so education will be, for me, I think the best place where if there will be השקעה, investment, we will ripe the corpse.
Yeah. Okay. So now is the time to invest. Otherwise, we will have problems down the line. Yeah.
I agree with you. Yeah.
So thank you so much for joining me today.
Thank you.
And kind of giving your input on this, I think, really important topic.
Thank you so much.
And thank you, everyone, for listening, and see you in the next podcast.